Madam, you can start after 2 minutes. We'll wait for 2 minutes. After that, you can start, madam. Archana, ma'am.
Hello, good afternoon. Hope I am audible. Dr. Amulya, am I audible and visible?
Yes, madam. Yes, madam.
Okay. Okay. So, we shall start today's class where the topic is one is difference between Panchakarma and Panchashodhana, and second topic is relevance of Panchakarma in today's life. So basically, when we hear these two words, Panchakarma and Panchashodhana, it feels as if both are same, right? All these days whenever we want to do some chikitsa in Ayurveda, it's Panchakarma. We say it without a single thought. We say it as Panchakarma, and classically there is one more word as Panchashodhana. So why don't we use that word Panchashodhana when we are referring to some treatments in Ayurveda? Why we only tell we have Panchakarma center, you can go through Panchakarma treatment. We never say this Panchashodhana word, right? So to know further about Panchakarma, we should know the basic difference between these two words actually. So let us start with that. So in this slide, you can clearly see the difference. In the previous class, we had dealt with this word Panchakarma, where we were telling about Upasthita doshas. When Acharya Charaka mentions Tan Upasthita doshanam Snehasvedopapadanaihi Panchakarmani Kurvita. That is the first reference we get from Charaka, right? Panchakarmani kurvita matra kalo vicharayan. That is after knowing the matra, kala, etc. Please advise Panchakarma to patient where there is upasthita dosha. This is the first reference. And what about this Panchashodhana? Panchashodhana is the concept of Acharya Vagbhata, where he tells Yadirayet Bahir Doshan Panchada Shodhanam Chatat. He refers this, it is in Ashtanga Hridaya Sutrasthana, that is 14th chapter, where he is telling about where Shodhana procedure has to be done. Yadhirayet Bahir Doshan. For that, Aruna Datta comments telling that Yadhirayet Bahir, that is Bahir Irayet. That shloka tells Bahir Irayet, that is Kshipet. You have to remove it outside. For that purpose, you are going to do Panchashodhana. This is the opinion of Acharya Vagbhata. And he tells what are those Panchashodhana. Okay. So basic difference is Panchakarma is the word coined by Acharya Charaka. Panchashodhana is the word coined by Acharya Vagbhata. So now what is the basic difference when it comes to the Chikitsa, or else what are these 5 karmas, or what are these 5 shodhanas? We will know it one by one. So when Vagbhata tells Panchashodhana, he is very clear about what are those. Shodhana, you know. When the doshas are in the koshta, which are ready to come outside, we give shodhana. But Panchakarma is not the same. Panchakarma includes Panchashodhana. Okay? But Panchashodhana comes under Panchakarma. Hope I am clear in this. Panchakarma includes Panchashodhana. It means that Panchakarma has more than Panchashodhana, right? But Panchashodhana comes under Panchakarma. It is a part of Panchakarma. Okay? This is clear. So 2 parts are clear. One is Panchakarma is told by Charaka, Panchashodhana is told by Vagbhata. Panchashodhana comes under Panchakarma, and Panchakarma includes Panchashodhana. Next point is all procedures, that is Purva Karma, Pradhana Karma, Paschat Karma, etc. For all karmas have been mentioned under Panchakarma. But in Panchashodhana, we see that Purva Karma, Paschat Karma and Pradhana Karma of only Shodhana procedures have been included here. And in Panchakarma, under the heading of Panchakarma, we see that all types of doshas we do this. Lina dosha, Utklishta dosha, Upasthita dosha. But Panchashodhana is done only for doshas which are Upasthita in Koshta. That is, we do certain Deepana, Pachana, etc. Then we bring the doshas from Shakha to Koshta. Then we do this Panchashodhana. Because, see, in Panchakarma, I'll give one example. Panchakarma includes Anuvasana Basti also. Here, Anuvasana is not Shodhana, right? Anuvasana is basically Stehana in nature. So, all Purva Karma, Paschat Karma mentioned for Matra Basti or Anuvasana Basti, etc. are included under Panchakarma. But Panchashodhana does not include Anuvasana Basti or else Brahmanasya, etc. It's only Shodhana. That is where the doshas have to be thrown out. Okay. So Panchakarma is, next point is Panchakarma is applicable for both Swastha and Rugna. That is Rutukalina Shodhana also come under Panchakarma. Also you have a patient where you need Snehana in their body. We do Panchakarma is done there. But in Panchashodhana, it is mostly done for Rugna, and Rutu Shodhana also comes under Panchashodhana, no doubt. But Panchashodhana is done for Rugna majorly, and Panchakarma can be done even if the patient comes to you and says that I want to go for purificatory procedures, you can do. But Shodhana always has to be, for example, this Brahmana Anasya. You need not wait for Rutu Shodhana, right? Rutu to come. You can do it. But Shodhana procedures usually done in patients and where the doshas are in Upasthita form, and Rutu according to that is Vamana in Vasanta and Virechana in Sharad. This is the restriction for Panchashodhana. Then the end result. In Panchakarma, it can be Langhana, it can be Brahmana, it can be Snehana, Utkleshana, Shamana, etc. Because Anuvasana Basti is going to do the Utkleshana, or sometimes the Brahmananasya is going to do the Shamana of Vata. So, end results of Panchakarma is it can be Langana Brahmana, Snehana, Utkleshana, Shamana, etc. But in Panchashodhana, it is mostly or mainly it is Langhana in nature. That is, it causes apatarpana in the body. Then coming to the karmas, what are included under Panchakarma? They are Vamana, Virechana, Basti, Nasya and Raktamokshana, according to various authors, like Charaka tells Basti, and for Shushruta, that is Matantara, right? Shushruta tells Rakta Mokshana has to be included because they consider Rakta as one of the doshas. So Vamana, Virechana, Basti, Nasya and Rakta Mokshana are considered as Panchakarma. Whereas Vagbhata clearly mentions what are the Panchashodhana. He tells Niruho Vamanam Kaya Shiro Reko Asravisrutihi. He tells Niruha Basti, Vamana, Virechana. He tells Kaya Shiro Reko. That is Kaya Rechana and Shiro Rechana. That is Vairechanika Nasya and Virechana. Along with Rakta Mokshana, they are called as Panchashodhana. It is very clear that Anuvasana is not mentioned here. And only Vairachanikanasya is mentioned, not the Shamananasya and Brahmananasya, right? So now it should be clear for you that any procedure which ends with Langhana, which has certain Purva karmas, Paschat karma, and where the doshas are in Utklishta form, only that can be considered under Panchashodhana. They are Niruhavasti, Vamana, Virechana, Shiro Virechana, and Rakta Mokshana. Whereas here only Basti is mentioned. It means that both Anuvasana and Niruha are included. Nasya is mentioned where all types of Nasya can be included. And Rakta Mokshana is also there under Panchakarma. So Panchakarma is a comprehensive treatment where it can be Brahmana, Snehana, Langhana, all. But usually Panchashodhana, it alone cannot be given. It has to be Panchashodhana, should include other types also. For example, Niruha Basti alone cannot be administered in a patient. It will cause Vata Vruddhi. You have to take help of Anuvasana Basti also. So this difference is only for understanding rather than application. So basically, whenever you are in clinic, whenever you are practicing, it is the Panchakarma what you are going to do, right? So this is a subtle difference. It is not a major difference, but it is a syllabus topic where we have to know about these two. I think this has made it clear. Panchakarma is mentioned by Acharya Charaka and Panchashodhana is mentioned by Vagbhata. Panchakarma includes Vamana, Virechana, Nasya, Basti and Rakta Mokshana. Whereas Panchashodhana, they are Vamana, Virechana, Niruha Basti and Vairechanika Nasya and Rakta Mokshana. Panchakarma is a comprehensive treatment which brings about Langhana, Brahmana, Snehana, etc. Whereas Panchashodhana is mainly Langhana in nature or Apatarpana in nature. And Panchakarma can be done for Lina dosha, Utklishta dosha and Upasthita dosha, whereas Panchashodhana is clearly mentioned for Upasthita dosha. Okay, so this is about the difference. These are the key differences between Panchakarma and Panchashodhana. Next topic we would like to deal with today is the relevance of Panchakarma. Why should we know about Panchakarma? Like, what is the need? So first thing we know about today's lifestyle, right? Major diseases what we are encountering today, it's because of the lifestyle disorders, whether it is obesity, diabetes, or cancer, or else migraine, you name anything, lifestyle is contributing a major part in it. So relevance of Panchakarma, I have dealt in these 8 points. First thing is lifestyle disorder. Second is stress. We know stress is positive when we gain some result out of it. For example, if I tell there will be no exam, no child will be interested to study. Positive stress is always needed, that to deliver something we should go through some stress, positive stress. But when it becomes negative, when it starts affecting our mental health and physical health, then it is negative. So that is the second point. Third is pollution. We know that the environment outside is not the same now. We have pollution in every Mahabhuta, right? Whether it is Jala, whether it is Agni, whether it is Prithvi, Akasha, Vayu, whatever you take, all Mahabhutas are polluted for that matter. So, according to Lokapurusha Siddhanta, whatever is polluted outside, the same we consume, right? So, that pollution is also a major culprit now. And fourth is cancer. Though this cancer was not, the word cancer was not known for a long time, now it is very, very common. And it is becoming common in unpredictable ways. That is, one simple example, a patient who is consuming tobacco getting cancer is very predictable, right? But who is having a very healthy lifestyle, who is out of all addictions, in such individuals, if you get lung cancer, or if a patient has ovarian cancer or breast cancer, when he has very good lifestyle where the weight is maintained, there is no reproductive issue, then it is very unpredictable, right? It has become very, very, very common nowadays. Next is autoimmune diseases. um, as the name suggests, it is autoimmune. We don't know the reason yet why the body is attacking its own cells, right? So probably Panchakarma has answered to this autoimmune disorders. Next is mental illness. Though stress and mental illness, they come under same heading, but mental illness, it sometimes it can be hereditary also, and some can be due to some indirect causes like intake of some medications, or else the environment where they are like um, abuse, etc., that can cause mental illness. There are so many reasons for a mental illness, not only stress. So I have taken these two entities separately. Next is geriatric care. Why we need geriatric care? Because the lifespan is increasing day by day. People who used to, means the age life expectancy was very low before. Now it is very high. People stay alive till 80 years, but the quality of life is very, very low. So we need that geriatric care now, because as the age progresses, the number of illnesses they have also is increasing exponentially. So we need Panchakarma to deal with this geriatric illnesses. Last is digital world. We stay in digital world, and this was very uncommon previously. Like people used to talk directly rather than through this telecommunication media. They used to talk directly, or else through landline, or else through letters they used to communicate with each other. But now everything is digital, right? Now even the class we say, we it is becoming digital. So in like whatever advantages we have, it comes with a baggage of disadvantages also. We are surrounded by radiation. We are, because of the continuous usage of at the screen, we are exposed to dry eye condition, or else ocular lock, or else cervical spondylosis. We have a lot of issues related to this digital world. So these are the few headings. Apart from this, there are n number of reasons why Panchakarma becomes relevant in today's life. But I felt these are very important, so I thought of dealing with this. So first is lifestyle disorders. We know that because of our lifestyle, where even after the sunset we work, right? Even after the sunset we are working now. But whether uh, that was recommended previously, people used to go back to their homes, they go back to their um, uh, routine after finishing the job. Now it is like even after the sunset, the lights will be on, and people become active after 6 o'clock, and they sleep very late. And we have night shifts also, which was very uncommon previously. And apart from that, the traveling distance has increased, and the sitting work, that is the table work, has increased. There are so many reasons for this lifestyle disorders, and you can name any disease and there is this influence of lifestyle in it, right? Whether it is obesity, whether it is infertility, the PCOD cases, whatever you name, there is a part of lifestyle contributing to it. And how are we going to deal that through Panchakarma? We know that through our dinacharya, through Rutacharya, we are going to manage it. No problem. But how Panchakarma is going to help? We know that when we read about the Falashruti of this Panchakarma or Panchashodhana, it's very clearly told that Malapaham Rogaharam, Balavarna, that is Swaravarna Prasadanam, Pitva Samshodhanam Samyak Ayusha Yujjate Chiram. It tells that by doing proper Panchakarma or Panchashodhana, what you are going to get? It tells Malapaham. It tells whatever Rutu Swabhava Kupita dosha is there, that is according to Rutu, there will be Sanchaya Prakopa of doshas. You can overcome this effect of this Rutu Swabhava Kupita doshas by the Shodhana, that is Malapaham. Second is Rogaharam. It tells whatever Nidanas may be, but when you undergo this Panchashodhana or Panchakarma, it is going to do Rogaharam, Malapaham, Rogaharam. And third thing is Bala Varna Prasadanam. It gives Bala, Varna, etc. So, this can be considered even as Rasayana. Bala Varna Prasadana is the Rasayana effect, but before Rasayana, we are going to do Panchashodhana, right? Or the proper Shodhana will be done before administering Rasayana. So, whatever may be the lifestyle disorder, when we make the patient undergo the Panchakarma procedure, he will overcome the Mala Sanchaya which is there. He will overcome the Roga whichever he is suffering, and also it will give him Bala and Varna which is needed to fight the diseases. So, by that shloka, we can understand that whatever may be the lifestyle disorder, we can clearly see that Panchakarma is going to deal with it. And also, whenever you read about Staulya, he tells that in Staulya Chikitsa, Apatarpana is the line of treatment. And if you go to Madhumeha, though directly Shodhana is not advised, but few of the maybe mild Vamana, mild Virechana with Mrudu Vegas we can perform. And if you come to hypertension, Virechana is one of the line of treatment. So whatever lifestyle disorder you take, if we do Panchakarma and then give him oral medication, the effect will be more. So next point is, this is about lifestyle disorder. Next is stress. In stress, though we know stress acts directly and also indirectly to, just a second. Amulya ma'am, can you just move
Yes, ma'am.
just can you go to the next slide, ma'am? Yeah, yes. Yeah, that should be fine. Yes. So, stress, as we know, it deals with both physically and mentally, it drains our energy, right? So, we know that because of stress, people are suffering from diabetes, hypertension, heart diseases, and other mental illnesses. And we know that when we read about the Swastha definition, we know that prasanna atmendriya manaha, right? When manas is prasanna, other things follow. That is, when we want a person to be swastha, we have to take care of all this. Prasanna atma indriya manaha along with the deha also. And when we read about ahara sevana vidhi, he tells that mindful eating, which is a trend now. Ahara Sevana Vidhi, it has been told that is when you are having food, it should be Ushna, it should be Snigdha, etc. Along with that, last part is you should be mindfully eating it. So we know how mind is involved in every corner of the Ayurveda. That is, whether it is having food, whether maintaining the health, or whether a treatment part, whatever, we see that Manas is an entity. Coming to the benefits of Panchakarma, there also it tells Buddhi Prasadam. So, Buddhi Prasadam is one of the Falashruti of Panchakarma. So, we know that whenever there is stress which is affecting mentally and also physically, Panchakarma would really help. And we know that apart from physical illnesses, Charaka, Vakbhata, and our acharyas have given importance even to Unmada, Apasmara, Mada, Murcha, Sannyasa, and also we have few yogas which are very common to physical and mental illnesses. For example, Kalyanakagrita. It is mentioned both for Pandu and Apasmara, Unmada. So, how much ever physically importance is given, some same amount of emphasis has been laid even to manas also in our classics. And when we read about Pathya, he tells that Pathyam Patho Anapetam Yadya Choktam Manasah Priyam. But Pathya is the one which is going to do the, that is, it is going to clear the path of the Srotas, and also it should be one which is Manasah Priya. Okay, it should be Manasah Priyam. Amulya ma'am, I think we went to the last slide. Amulya ma'am? Ma'am, can we go to the previous stress slide? Yes, yes. Okay. So, Pathya is, it is whatever we suggest after Panchakarma, that is the Pathya. That also tells that it should be Manasaha Priyam. Everywhere, whether it is Purva Karma, Pradhana Karma, Paschat Karma, or the diet which is mentioned after that, which comes under Panchakarma, everything is like both Sharirika and Manasika Bhavas are taken care of. And apart from all this, a wonderful gift Ayurveda has to offer in the stress and mental illnesses is Mastishkya. That also comes under this Panchakarma procedures, where it includes Shirobasti, Shiropichu, Shiro Dhara, etc. So, this Mastishkya is mainly meant for the Manobhavas, and that can be practiced without any hesitation in stress and other mental illnesses. Next comes the pollution. We know that whether it is the water pollution or the air pollution or the land or the soil pollution, etc., it adversely affect the quality of our life, no matter what. So, though we cannot directly apply anything on it, but we can see that we know the word detox, right? We can apply this panchakarma on individuals or everybody for that matter to see that the pollution is having minimal effect on our body. We know about Janapadodvamsa, which has been clearly mentioned, which has been clearly mentioned in Ayurveda. That itself suggests that even they were aware of things like this. And what to do in this? We have Nasya, where we can, for instance, I usually suggest patients who travel by two-wheelers in areas where we see that the pollution level is very, very high. We usually suggest Pratimarshanasya in them, because whatever the Pratimarshan, the Taila we apply through Nasya, that will have effect of filter. Okay, so by Shodhana, we see that whatever mala, Sanchita mala is there, we are going to remove it. Basically, by following Panchakarma, we see that whatever pollution has its effect on our body, we are going to minimize it. though may not be directly, we cannot avoid pollution directly, but we can minimize the effect of pollution on the Sharira. And of course, Rutu Shodhana is there once in a while, that is Vasanta Vamana and also Vamana Vasanta and Virechana in Sharad Rutu. That will see that your cells are working optimally by doing the Rutu Shodhana. And Achara Rasayana is wonderful because that will tell Achara Rasayana which comes under Rasayana, and here that is it tells you how you have to behave. Okay. For that Rasayana Chikitsa, you have to go through Panchashodhana and then Rasayana is applied. Here, Achara Rasayana is the Sadvrita what we have to follow. Okay. So you can suggest Rutu Shodhana followed by Achara Rasayana in individuals who want to contribute something to the nature. Next is cancer. Though we know that it's a very huge topic, but in many conditions we are seeing that Ayurveda is going to help in them in a very unknown, like unlimited way. It is helping them, though we are not able to come to one conclusion how it is doing it, but we are seeing results in so many patients when we do Shodhana procedure or Panchakarma procedures in them. First is by Shodhana. What say we know that in cancer is nothing but where the cells are getting multiplied in a the intensity of multiplication is too high in cancer. So by Shodhana, what we are going to do is we are arresting that multiplication at a level, cellular level. That is one thing. Second thing is by Shodhana, we are giving him that bala to fight the malignant cells. Then by Shodhana, we are increasing the bala in patients who are undergoing chemotherapy or radiotherapy for that matter by indirectly giving him some bala. And after Shodhana, no doubt we have to give them Rasayana. And with Rasayana, Vachikarana has to be given because by chemotherapy and radiotherapy, along with malignant cells, the cells, normal cells also get affected. So Rasayana and Vachikarana are must, but it has to be followed by Shodhana, no doubt in that. Along with that, Rutucharya, Dinacharya has to be followed, and Langhana, that is fasting, which is a part of Panchakarma, has to be followed in cancer because they say fasting makes the body very susceptible, right, for any change. For example, if you want to achieve some probably a patient is there who wants to achieve weight loss, okay, along with nutritional diet, along with restriction in the calorie, if we ask them to fast, the result will be more, right? So fasting makes the cell thrive for nutrition. When the cancer cells are there in the body, when you ask the patient to fast, then automatically the cells fight for that survival. Okay, so survival of the best, we know. So Langhana is the best line of treatment in cancer along with Panchakarma. Then coming to autoimmune disorders, though we don't know why this is happening, that is autoimmunity is developing in a certain individual, but we know that that can be overcome by Shodhana because in multiple, recently I listened to one of the speaker in a seminar where she was telling that multiple sclerosis, she has treated without thinking it as autoimmune disorder. She got the case and she started treating it, and she has found wonderful result with that. She has done Panchakarma in that case. So there are many such examples where autoimmunity can be reversed to some extent by this Panchakarma procedures. And we know that by Panchakarma it tells that Dhatu Stiratvam. Very clearly the Falashruti tells that Buddhi Prasadam Balamindriyanam Dhatu Stiratvam Jalanasya Deeptam. So Dhatu Stiratva is very well documented in case of autoimmune disorders by Panchakarma. And of course, Rasayana is a line of treatment in autoimmune disorders, but it has to be done after Panchakarma is done. Last part is this geriatry. So we know that as age progresses, the patients will be having lot of illnesses in them. So probably they need some rasayana chikitsa, vajikarana, brahmana, mastishka, etc. A simple example I can tell you: patient as the age progresses, they'll have issues with constipation. Okay, they'll have issues with eyesight and issues with hearing. So we can go for this pratimarshanasya or Brahmananasya or Anuvasana Basti, that is Matra Basti, Sneha Basti. So we can, though not Shodhana, but we can involve them in some Panchakarma procedures where uh, they may feel improvement in the quality of their life. We cannot change much in the aged patient, but we can improve the quality of life by Panchakarma because he tell in Charaka Siddhi there is one reference where he tells iti atura swastha sukha prayogo balayusho vruddhikrit amayagnaha. That is, by Shodhana, by Panchakarma, what we are going to achieve first is balayu vruddhihi. There will be vruddhi of bala and ayu, and also uh, amayagnaha. Whatever issues they have, there will be rogahara. The Panchakarma will do that. So basically, how we are going to implement this Panchakarma through Vamana, Virechana, Basti, Nasya, etc. and also Rakta Mokshana. What we are going to do? Either we are going to manage the pain, and also we are building the immunity, and we are improving their lifestyle. That is by through Achara Rasayana or through Sadvrita and also Rutu Shodhana, etc. We are optimizing their lifestyle, and there will be stress relief. As we know that it is buddhi prasadam, it gives that uh, clarity in the mind. And also in some cases we can even avoid surgery. For example, in gallbladder stones, when we have we usually advise mrudu virechana or nitya virechana, where the surgery can be prevented. And the digital detoxification by giving mastishkya and also giving akshitarpana, etc. We see that whatever effect this digital world has on the patients, we can minimize it. And apart from all this, we can have this Panchakarma as a preventive healthcare technique. That is, whatever we are expecting, that is change. For example, now if you have a patient of Tamakashwasa, and you can advise Panchakarma to see that he'll have a quality life during the winter. Okay, you can advise him, you can have the Panchakarma for preventive purpose also. This is the summary why, what is the relevance of Panchakarma in today's life. And to know all the effect of this Panchakarma, I have just quoted